Hello, everybody, and good evening. Thank you for tuning in to our latest Ask the Leaders Facebook Live Q&A. I'm Keith Aspden, the leader of City of York Council. Some of you will know that the council's held a number of these Facebook Lives over recent months, including the latest public health advice, business support, and higher education guidance. But this is now the third time this week we're holding one of our live Q&A sessions. But all of us will know that this week has been pretty eventful, to say the least. Having held a public health update session on Monday, we're once again joined by representatives from public health and business sectors to discuss what the news announced by the government only yesterday, that York is to be moved into level 2 high, will mean for residents and businesses. And I'd like to thank the panel for giving up their time today. Tonight, we'll be taking a closer look at the latest guidance, data, available support, and the city's ongoing response. Unfortunately, COVID-19 infection rates in the city are rising and above the national average, as we have seen in other areas of the country, and we can't be complacent. As I'm sure you'll be aware, yesterday saw York placed in the high level of the new 3-tier restriction system, which was outlined by the Prime Minister early in the week. This means that some additional restrictions beyond the current national guidance will be introduced for York's residents and businesses tomorrow. Primarily, no mixing between households indoors unless an exemption applies. I will in just a few minutes ask Sharon Stoltz, our Director of Public Health, to outline this in a little bit more detail. This year has been exceptionally difficult for everyone, and we are grateful to residents and businesses across the city who have gone to great lengths to adapt to the new guidance, to volunteer, and to protect our city. Businesses in York have really stepped up, innovated, and adapted to remain safe and welcoming for residents and businesses. So it is crucial that we continue to support our vibrant local economy by shopping local and working together to protect the people and places that we love. It is clear that the next few weeks are going to be challenging for businesses across the city, and that is why we're stepping up our lobbying efforts to call on the government to deliver urgent financial support, not just for local areas, but also for businesses during this difficult time. We'll continue to work with the city's businesses and partners to ensure that all is done that we can to protect livelihoods and jobs across York. But in turn, the government must now step up and introduce a comprehensive support package, as you've seen called for across different northern towns and cities, to aid all efforts in retaining employment in the city and supporting businesses from our local pubs to those in our high street. Despite the challenges of this year, York has demonstrated what it does best, residents coming together and supporting each other. And it's going to be crucial that we continue in this spirit and work together over the coming weeks and months. Now I'm going to stop and ask the panelists to introduce themselves briefly before handing over to Sharon. So in no particular order, just the order that you appear on my screen at least. Andrew Waller.
Hello, I'm Councillor Andrew Waller and I'm the Executive Member for Economy and Strategic Planning.
Thank you. Andrew Lowson.
Hello, my name is Andrew Lowson. I'm the Executive Director of the York BID, which stands for Business Improvement District, and we represent about 1,000 businesses, mainly within the city centre.
Thank you. Sharon Stoltz.
Hello, everyone. My name is Sharon Stoltz, and I'm the Director of Public Health for City of York.
And Phil Mettam.
Thanks, Keith. Good evening, everyone. Phil Mettam, Accountable Officer for NHS Vale of York CCG, and that includes responsibility for the residents of the City of York.
Thank you, everybody, for that. If you haven't watched one of our Facebook live Q&As before, you might not know that we often get questions submitted in advance to the council, and we have received a really high number for today about the new restrictions, so thank you for those. But you can also add questions or comments directly onto our Facebook page. If for any reason we can't cover your question or cover all of the topics, as we've only got an hour, we will try and respond to all of them on Facebook, and you'll see a typed response there. If not, for extra information, you can look at york.gov.uk york.gov.uk/local restrictions, which is an updated page telling you all about the new rules and what it means for York. But on that, I'm going to hand over to Sharon to first give us a public health update about what it means for York.
Okay, thank you, Keith. So yes, I think probably most listeners will be aware that we've seen a picture over the last few weeks, really, since the beginning of September, of an increasing number of cases of COVID in York. We did very well as a city over the summer in keeping rates down. We were seeing maybe 1 or 2 cases a day. But since the beginning of September, those numbers have started to increase. And as Keith indicated at the start of this evening, our case numbers are now above the national average and are similar to the regional average for Yorkshire and Humber. Just to put that in context then, looking at what that means is we had 104 new cases of COVID since yesterday. So that's in a 24-hour period. So that gives you some idea of how quickly those numbers are rising. We're also seeing an increased number of people with COVID symptoms requesting tests, and we're seeing the number of those tests come back positive, increasing as well. So our positivity rate, as we call it, for the last 7 days is 15.66% for York. That compares to a national average of 8%. And a regional average of 11.6%. So that just illustrates where we are in terms of positive cases. We're seeing cases in all ages and across all parts of York. We are continuing to see higher numbers in younger people, but those numbers are beginning to change. And we're starting to see numbers of older people testing positive for COVID as well, which is obviously a concern because they tend to be more vulnerable. In terms of what these restrictions mean for York then, we still have to follow the basic guidelines that we've been asking people to follow up to now. So that's the importance of hand washing, regularly, the importance of using hand sanitizer regularly, carrying it with you and using it, the importance of wearing face coverings in public spaces, and the importance of maintaining social distancing. 2 meter social distancing is best. So we all need to continue to do that. But the additional restrictions mean that people are now not allowed to meet anyone outside their household or people that they've formed a support bubble with in any indoor setting. So whether that is their home, whether it's a pub or a restaurant, they're not allowed to meet. There are some exemptions to that, which are listed on the council's website. So you can go to york.gov.uk/local restrictions, and it will give you more information about those exemptions. People can continue to meet outside, but they need to ensure that they're not meeting in a group larger than 6. And we're encouraging people to be mindful of the number of journeys that they're making, and to try and not sort of spread the virus to other areas. So those are the main restrictions, and continuing with those 3 really important areas of hands, face, space. So I'll stop there, Keith, and I'm sure there's lots of questions that people will have.
Thank you very much for that, Sharon. What I'm going to do is start going through some of our pre-submitted questions first, and then I'll try and supplement that from any that come in on Facebook. And so the first question, which I think I'll ask Phil to answer first, and then you might want to add to it, Sharon, came from Katie, and it was, how confident are you that moving into tier 2 will protect residents from the further spread of the virus? Phil.
Yeah, thank you, Keith, and thank you for your question, Katie. The outline that we've just heard from Sharon goes to the very heart of this answer, really, which is our confidence will come from the extent to which across the city we see a set of behaviours that is consistent with that good practice and some of those basics that we've known about for some time. And so it very much comes down to our own individual responsibility and consistently behaving in ways that follow and adopt those good practices around hand washing and social distancing, and that we encourage our family members to do the same. And if we all consistently take that responsibility as seriously as we can, then over time our confidence should grow that we will see a change in the trend in the epidemiology that Sharon has outlined for us, that has shown that increase over recent weeks. So I think it's very much about personal responsibility.
Thank you, Phil. Sharon.
I mean, I would absolutely agree with what Phil has just said, and add that the tier 2 restrictions on their own will not be sufficient to stop us moving into tier 3, which is obviously something that none of us want to see happen. What's also important is that we have a really effective testing and contact tracing program in place. So part of that is about people, if they have symptoms of COVID, the importance of them booking a test. I know that it sometimes is difficult to get through straight away if you're trying to book a test online or over the telephone, but access to testing has improved, and if you can't get through online or on the telephone to book a test, immediately keep on trying. So that's really very important. And then if you are when you are contacted by the National Test and Trace Service, it's about sharing your contacts, and then the importance of self-isolating. And from next week, the local public health team in the council will be working alongside the NHS Test and Trace Service to supplement that with local contact tracing. But we'll only be able to do the contact tracing if people first of all book a test. So in addition to all of the measures Phil's just talked about, that importance of getting a test, self-isolating, and giving details of your contacts is really important as well.
Thank you, Sharon. I think the thing that comes across really clear to me is that prevention, hands, face, space is really important, but equally getting that test and trace system nationally and locally working is actually the best way to do this, rather than having to impose extra restrictions or local lockdowns in different areas. And I know that those of us in the city have been making that really clear to the Department of Health, that we want to do everything we can from our public health team to other partners in the city to help them work it through nationally to make sure there is enough capacity, it is quick enough, and the tracing works, and that we then support North Yorkshire Police in providing enforcement if people don't cooperate with that test and trace system. But sadly at the moment it isn't quite fit for purpose, and I know we'll continue to call to improve that, so that prevention and test and trace can go hand in hand to help us with all of those efforts that I know people are working on in the city. Phil, did you want to come back in on that?
Yeah, please, just on that fitness for purpose point. So many of the viewers may have experienced over recent weeks, or had family members who've experienced frustration with the national system or seen it through the media. The message that I want to convey is it is getting better, and is getting better almost daily. So if you have any concerns, please don't be influenced by an urban myth or concerns that you may have heard of in recent weeks. The reality of our position this week going into next is it is much better. Please do as Keith suggested and get a test.
Thank you very much. The second question I received is linked to that, and that was from Hannah, which was sent in earlier on Facebook, which was how long will we be in tier 2-4? If I could ask Sharon to answer that one, please.
So this is an interesting question, because obviously it's government, the national government, who determines what tiers local authorities go into, and it will be the government's decision when local authorities come out of those local restrictions. But if I can say something about what influences those decisions. So the government take advice from public health experts, from the Joint Biosecurity Centre that is monitoring all of the public health data, the epidemiology as we call it. And so they will be monitoring case numbers and how many positive, how many COVID positive residents there are in the city. They'll be monitoring that positivity rate that I talked about earlier. So what's happening with that positivity rate. They'll be very looking very carefully at what the impact is on the NHS. So they'll be monitoring admissions to general hospital beds and ITU. And they will also be monitoring the number of outbreaks that a local authority area is having, and how effective that local area is at managing those outbreaks. So the crucial thing, I know this is beginning to sound a bit repetitive, but the crucial thing is what we've just talked about. We have to work together, everyone in the city, to follow the rules, keep ourselves safe, keep our friends and family safe. That will help reduce the spread of infection. It will bring the number of cases down, the positivity down, and we'll be able to protect the NHS from seeing hospital admissions of people with COVID. So all of those factors together, the government will be looking at when making a decision to move us back into tier 1. So everyone in the city has a responsibility to work together to ensure that that happens. So our success as a city and our success at preventing us going into tier 3 is down to everyone who's watching and all of your friends and family.
Thank you for that, Sharon. I'm going to go to one of the questions that we just had live through on Facebook, which was from Ben, who asked, should a test be requested if no symptoms are shown, even if I've been in contact with somebody who has now got COVID?
So we're only asking people to request a test if you have symptoms of COVID. But people should be self-isolating for 14 days if you do come into contact with someone with a positive case. This means, this is partly because we know some people can be asymptomatic, and also it can take a while for symptoms to develop, which is why we say for somebody who has been tested positive, they need to self-isolate for 10 days, but if you're in a contact for 14 days, so that we can be sure that you're out of that infectious period when you leave self-isolation and go back to work or your social activities.
Thank you very much. Now I can see a few more questions coming in on Facebook about what the new restrictions mean. So after a couple more questions, I'll come back to that so that we can keep talking about what those restrictions mean. One of the second big areas that we got questions in advance was around businesses and local economic support. So for example, Katie asked us, what is needed in terms of extra support that being placed in tier 2 does not negatively impact on businesses? If I'd ask Andrew to answer that one. Sorry, Andrew Wallace, when I've just realised we have two Andrews.
I think it was discussed earlier today, and I think Andrew Lowson should come in initially on this one, and I'll pick up after.
Oh, I'm not going to go. I'm not going to bring you in again now. Other Andrew.
Yeah, no problem. Yeah, I mean, Andrew and I were talking earlier on, and we were talking with representatives from retail and hospitality, because as you can imagine, yes, that there is a lot of concern about what this means for business. I mean, I'll give some positives, because I think, we always like to try focus on those. And I suppose, just so people are aware of how York has performed over the summer. I mean, I think we've benefited, I suppose, from the fact that there was a lot of staycations, and York being obviously a popular place to visit at the best of times has, businesses did, after a very difficult lockdown period, were able to recover some of their losses, particularly in the areas of retail and hospitality, where obviously we have a lot in the city centre in particular. So, for example, we were down on our usual footfall, but compared to other cities, we did well. And I think that's obviously naturally because of, where York is as a city to visit. But as a city, as partners, I think we work very well. We looked at ways of expanding the foot streets to make the more pleasant. A lot of work was done to get cafe licenses, outdoor seating, where we know people are more comfortable. We put hand sanitizers, cycle racks. So I suppose as a city, I see that we reacted very well to help the business community. And certainly, I'd like to think a lot of people would agree that actually businesses were very quick to adapt as well. So, you go around a lot of businesses, they have signage, they adapted their ways of working. And I think because we've got a lot of independent local businesses who can be very fleet of foot, that really helped. So I think, that's positive. I mean, there's no two ways about it. There's a lot of concern now that we're in the tier 2, because the worry is that market still going to be there for people to trade? So I think certainly speaking to businesses, especially in hospitality, I think they're very keen to see bodies like ourselves, maybe national bodies like UK Hospitality, to really lobby on support for businesses that are in tier 2, because you may have seen that businesses in tier 3 are going to be able to get access to a furlough equivalent scheme to help them, some grants. In tier 2, that isn't there. So obviously businesses have restrictions on how they can trade, but no access to government support. So I think that's one thing that we really need to try, lobby as a city and support our business community that way. But I think, probably our marketing now, because we need to be realistic, we're not going to be getting numbers from other parts of the country that we'd normally get. I mean, for example, take Liverpool. We know we get lots of people from the Liverpool area who now, being in tier 3, they should not be traveling here, and they will not be traveling here. So we really need to tap into those local audiences. And I think, ourselves, Visit York, again, the council, we really need to push out that message to local people to, please do use your local shops and businesses. We need you, obviously do it in a safe way. And I think that's why we need to get the balance of the messaging right. So I think there'll be a lot of work on that. And then I suppose, one thing that was successful this summer, I've already mentioned the cafe licenses, the bid. We worked with the council and we put up an outside space on College Green that proved hugely popular with the public. So I think we're looking at how can we do those equivalent, I suppose, projects this winter, because we know that people feel more comfortable being outdoors, but we also know they want to support their city centre. And so I think the fact that there is less restrictions on when people are meeting outdoors, we need to try find ways of creating that outside space, but the difference being, obviously in the winter you need to probably have a little bit of cover, maybe a bit of warmth, and I think with those, three things I've mentioned in particular, that's really where we need to support the business community. But things obviously change on at the moment on a weekly, sometimes daily basis. So we just need to be adaptive and make sure that, we're giving businesses the information they need and then supporting them as much as we can do within the health guidelines.
Thank you very much. One question, Andrew, that I've got is quite a lot of businesses, particularly in leisure, hospitality, and local pubs, are saying that they're really, really worried about tier 2 compared to tier 3, exactly because of that point that you might not get much financial support with tier 3 as a business, but there's something. And I think the answer probably is joint lobbying with those businesses, with the bid and other partners, to make sure that people understand the impacts on those businesses. So if there are any business owners listening to this, do get in touch with Andrew, with Make It York or the council, so that we understand the challenges that you're facing, and in our contacts with the Department of Business and the Department of Health, we can make sure that they understand what impact these restrictions have on your trade, because we do appreciate what an important part of the community that you are. Andrew Waller, whether you wanted to.
Yeah, it was very much the messages that we're getting from some specific businesses is that they were already operating at much lower capacities to keep afloat, and these further restrictions will put them under specific pressure. Pubs that don't sell meals will be in a difficulty that they see tier 3 getting some support. So I think it's about working through and working together. Where there's evidence, we've taken lobbying to government where there's been businesses missed out from support, but I think it's about maintaining confidence. It is going to be more difficult in a colder climate to retain outdoor spaces, but I'm sure we will all work together to make that happen. And it's about getting a message that so much effort has gone into making the city centre businesses safe for people to go in. So that's certainly a message that we jointly are promoting, that so much has been done, but we recognise that there is going to be some people who need that bit of support from government.
Thank you very much. Andrew.
Yeah, I suppose I was just probably, because I noticed one of the questions was quite specifically about Spark York. Actually, does that count as a outdoors or indoors? And probably now is a good time to cover that one off, because the individual retail units within that, who some of them have a small amount of space, they would be classed as indoors. But underneath the larger canopy, that is classed as outdoors, because what they've done down there is they've left the sides off so you can still get that airflow through. I suppose the reason I mention, or answer that question at this time is I think that's a perfect example of, I was speaking to the management team down there, and they've actually had a better September this year than last year. So I think that probably tells us again, how we need to adapt our business models, or how we need to help businesses adapt, because actually, I think the reasons behind that is because people feel comfortable in that type of environment, that the layout that they've got the table service. So I suppose, that is a positive. Let's try look at the positives of what is working and what is appealing to the public. And I think as we, as the bid, the council and others, if we can help the pubs that Andrew was alluding to, who maybe are worried about that inside space or don't necessarily have it, it's how can we use that outside space in the city in a flexible way to make sure that they can benefit from the same conditions that obviously Spark are benefiting from at the moment.
Thank you very much for that. A couple more questions have come in on Facebook that I'll go to now. So there's one I'll ask Phil to come in on, which was from Anne, which is, are we positive York Hospital can cope with the potential increase in positive cases, and what measures are in place for testing patients before planned admissions? Phil.
Thanks, Keith, and thanks for your question, Anne. So yes, measures are in place for patients who would have a planned admission. So prior to an elective procedure, a patient would receive written correspondence from the hospital advising them on a personal basis about how to and when to get a test. So yes, those measures are in place. York Hospital, over the last 2 to 3 weeks, we've seen, and I spoke to Simon Morritt, the Chief Exec of York Trust, just this week, and Simon is seeing a steady increase in admissions, and at the moment the pattern of those admissions is not as steep as we saw in wave 1. We now understand the virus better than we did in wave 1, and we are more prepared than we were previously. So in wave 1, we did have challenges around securing PPE for our staff in York Hospital. That's in a much better place now. And over the summer months, we've started to get used to the different ways of working within hospitals. So the requirements for infection prevention control in hospital mean effectively we can see fewer patients in the same space because of those requirements, but we're now more used to that than we were before. So that gives us confidence. The challenge that we have, and we will continue to have, is our workforce within the hospital, who of course may have to self-isolate or may catch the virus or flu themselves. And so that would be our Achilles heel going into this next phase. And a message in there in relation to flu, please get your flu jab. And please get your friends and family to get their flu jab. That will be part of the picture in terms of the confidence that we have in York Hospital being able to manage through this next phase. Thank you, Keith.
Thank you very much for that. We've also had a couple of questions on travel restrictions that I'm going to ask Sharon to pick up. So we had one in advance, which was from Faye, which is, please can you clarify if people can travel in and out of York who live, for example, in Rydale? It's not clear. And then we've had a second question that's come through on Facebook Live from Kate, which is, I live in a medium risk area and I'm planning to visit an area just outside York in half term for a few nights. Is this allowed? Thanks, Sharon.
So in terms of travel into and out of York, there are no specific travel restrictions around that. All I would suggest to people is that they need to be mindful of how they're traveling and ensure that is COVID secure. So if you're traveling by public transport, then obviously bearing in mind social distancing, wearing face coverings, etc., is really important. But there isn't anything in the regulations, if you like, that says that people can't travel. In terms of being able to travel and stay overnight with friends, that's a bit more tricky, because the restrictions apply to mixing indoors with people that are not normally part of your household or your support bubble. So if you were traveling and you were planning to stay with friends for a few days, then that would actually breach that restriction around staying indoors with people. So that's a little bit more tricky. There are certain exemptions to that, which obviously we don't have time to go into here. So I would suggest that if anybody has any specific questions about that, you go on to the council's website and check the local restrictions, frequently asked questions that should cover that. Or if it doesn't and you still have queries, you can actually email a query through to the Public Health Inquiries account, which is inquiries.publichealth@york.gov.uk, if you've got any specific queries that you can't see answered in that section on the website.
Thank you very much for that, Sharon. One of the other main themes that we got was about schools. And the question that we had was from Paul, and this was, why is it not safe for me to go in somebody else's house, but it's fine for my lad to sit in multiple classrooms with up to 30 pupils? And a second question from Corinne, which was, our City of York Council claiming that fines for parents who aren't sending their children to school are a last resort? If you could reflect on both of those, please.
Yeah, okay. I completely understand the first question from Paul, because it seems counterintuitive, doesn't it, to not be able to have children mix outside, but then they're mixing in school. So I understand the question. The reason why it's different is that a school environment is considered to be COVID secure. So all schools have to go through quite rigorous health and safety risk assessments. And they have to put in place various measures to ensure that children are safe and to minimise the spread of the virus. And obviously, it's much more challenging to be able to do that in your own home. Schools also have in place track and trace measures. So, for example, if a school finds out that a child has tested positive, they contact the local public health team. We support them to do contact tracing and identify whether it's a staff or a pupil, who their close contacts are, and we have quite a rigorous process of managing that. So it is a different environment, and obviously under the new restrictions, households are discouraged from mixing, and that includes children. So there is quite a difference between meeting informally in homes and school environments. And I can reassure any parents watching that we've worked very, very closely with schools to ensure that children are as safe as they possibly can be in schools, so that they continue with their education, which obviously is really important. In terms of fines, yes, it's absolutely right. Fines are considered to be the last resort. Obviously, if parents have particular concerns about their child and perhaps specific circumstances, then please do get in touch with your school, and they will take the time to work through with you what those concerns are. But fines absolutely last resort, and we would be against the use of fines unless parents had, refused to engage with the school and there wasn't that ongoing dialogue. So yes, definitely a last resort.
Thank you very much for those two answers. Now, I promised at the start that I'd return to the whole issue of restrictions and what they mean, as we've had lots of different questions. So I'm going to bring Andrew in first on a couple of questions that we've had about hotels, but also working in other homes. So we had a question from Hilary on hotels, which was, are hotels and guest houses allowed to have guests in a tier 2 area? If yes, what restrictions apply? And we also had a question from Vanessa on working in other homes, which is, I'm a cleaner in people's homes, can I still do this? And that was also added to by a question that we received from Sue and Paul on Facebook, which was, can tradesmen still come into your home? I work as a mobile hairstylist. Can I still work? It's confusing. So there's quite a lot of questions there. But Andrew, if I go to you first.
So obviously quite a lot of details that people want in terms of their own situation. So in terms of hotels and guest houses in a tier 2 area, they are allowed to welcome guests. but guests themselves are only allowed to socialise or stay with people that they live with as a household or have formed a support bubble with. So those are the restrictions for the individuals, and the government is discouraging people from tier 3 areas from travelling in and out of their areas unless it's for essential reasons, and that doesn't include going on holiday. So that's in terms of hotels. In terms of tradespeople working, they will already be COVID compliant in the way in which they've been going into people's homes. So that can continue. It is in terms of officially registered tradespeople, and we would urge them to be aware of the ongoing need to maintain biosecurity in what they're doing, but that is still permitted in a tier 2 area. Thanks, Keith.
Thank you, Andrew. Andrew.
Yeah, I think I was just going to add that onto this one, that yes, I mean, we've no two ways about it. You know, spoken to a few people in the hospitality industry who themselves have been asking us questions about, you know, who they can, you know, how they should be dealing with bookings, etc. And I suppose I just wanted to raise this, just to kind of go back to the point earlier on that we were saying that, you know, businesses are taking, you know, their responsibilities very seriously. I know one restaurant in the centre of town, or one restaurant owner who's got two properties, who actually turned away 30 bookings last weekend because he believed them to be from parties that wanted to kind of come from parts of the country that shouldn't be traveling. So that to me was quite heartening, because obviously the temptation for a business in these troubling times is obviously, you know, take the money. So, you know, we are getting lots of questions through, and I just want to kind of assure local people that, you know, businesses are taking these responsibilities seriously and the health message seriously. So yes, whilst we need to help ways for them to trade, I think this is why, you know, all this kind of information sharing, you know, the public messages that are going out are really important, because, you know, it's confusing for businesses, it's confusing for members of the public, but the more we talk about it and the more we share information, the easier it will be to get through this.
Thank you very much. Sharon, did you want to add anything to that?
I suppose the only thing I would do is just emphasise the point that Councillor Waller made about, you know, we're not saying that people can't come and stay in York. We're not saying that they can't come for the weekend and enjoy York as a city. What we're saying is that people need to do that safely within the restrictions, and that when they're here, they will be expected to respect the city and just follow those restrictions really around, you know, hand washing, face covering, social distancing, and we're still welcoming people to the city. I think that's an important message to get across. The city's not closed, it is open. We are welcoming people, but we expect people to behave responsibly. And if they don't behave responsibly, then we'll start to look at what enforcement measures we can put in place to tackle the tiny minority who aren't visiting the city safely.
Thank you very much. One of the other areas of restriction that we've had quite a lot of questions in is around sport and leisure. So if I go back to you, Sharon, in a second, there was a question that came through from a BBC Radio York listener, which was, are indoor sports allowed? And there was a question from Amy that we had through just on Facebook. I run a dance and fitness class. How will it affect gyms and fitness classes, please?
Okay, so this is not straightforward, which is why I think referring to the to the guidelines on the website, the council's website, to decide which category your particular activity fits into would be helpful. But briefly, if I can just say here, organised sport can still take place. within certain restrictions. So there has to be a COVID-19 risk assessment, etc., in place. And social distancing needs to be maintained. But that is organised sport, informal type sports inside we wouldn't be encouraging. But there are exceptions to that rule for young people and for people with disabilities as well, which is why it's difficult to give one definitive answer here. But as I said earlier, if people aren't sure about whether they're able to continue with the activities they have been, check the website or contact that inquiries.publichealth email account and pose the questions so that we can look at these on an individual case basis.
Thank you very much for that. Following that theme, we've had another few questions about people running businesses from home. So we had a question from Amy, which is, can you please advise on businesses that are run from homes, such as registered and insured beauty businesses? And then equally, we had a question about lodgers from Michelle, which was, I was going to advertise a spare room, should I wait? So if I could bring Andrew in first.
Right, in terms of the operating a business from home, there shouldn't be any changes to the existing rules as we move to level 2, because they will already have done their COVID risk assessment and be working in a way that recognises the risks. So it's worth just double checking on the coronavirus web pages, either through the council's link or direct on gov.uk, just to verify that you've done those risk assessments. And in terms of renting out rooms, that could still happen, but in effect you would become a household with that lodger, so you would need to make sure that you're comfortable with that. But there's nothing in the tier 2 restrictions that prevent households from moving house, which would be permitted.
Thank you very much for that. One question we were asked in advance around health and data was from David, which came through on Twitter, and that was, and I think I'll go to Phil first on this one. How many cases have recovered? Could this be included in current numbers?
Thanks, Keith, and thanks for the question. I'm probably going to give a really unsatisfactory answer, so apologies. My understanding is that nationally and regionally we are not yet systematically recording recovery data. I don't know whether, and Sharon, this is going to be a hospital pass, so my apologies. I don't know whether in York we are trying to do that at a local level yet. I'm certainly not seeing that data come through myself.
So I can add to that. Yes, Phil is absolutely right that it's not collected routinely nationally. We have been collecting that data from York Hospital for some months, actually. And that data is, I understand, publicly available on the open data platform. Perhaps somebody can add that link onto Facebook, but you can Google it, York Open Data Platform, and you'll get to it. So we are recording that information. One of the other pieces of data that we are planning to collect but are not collecting yet is the number of people who recover from the initial infection with COVID, but then go on to develop this syndrome called long COVID, which I'm sure listeners will be aware of. At the moment, we don't really have very good information about the number of York residents that might be impacted by that. which is obviously important information for us to know. So we've just started to have conversations locally with primary care, with GP practices about how we might start to capture some of that data. So watch this space in terms of that, but certainly we do collect the data on the number of people that are discharged from hospital having been recovered.
Thank you both very much. I should say you can tell it's live when I get people with a question or give it to the wrong person. So I apologise for that as well. One question that again a number of people were asking in advance, and I'm going to ask Sharon to answer, although this is a tricky one. Why did the government not move York into Tier 2 on Monday? What had changed over the 3 days for this decision to come into place so shortly after the government announcement? Might be unfair to ask you, but
so the short answer is I don't know. The slightly longer answer is that people will be aware that the government are in the process of moving from the old watch list, where local authorities were put onto the watch list as areas of concern or areas of intervention. And there were discussions, and we discussed some of that publicly, that we felt that, or I felt that York might be going into an area of concern, which would probably have put us into Tier 2 at that point. But then the government changed the system. They didn't announce the new 3 tiers until whenever it was, Monday, was it? Seems like such a long week. I think it was Monday. Which and York was put in with North Yorkshire. So North Yorkshire was put into Tier 1, just as West Yorkshire and South Yorkshire were put into Tier 2. Obviously, then through the week, our numbers of cases have been increasing. Hospital admissions have been increasing, and our positivity rate has been increasing. And so there was further work that went on through the week, which determined that York would go into Tier 2, even though the rest of North Yorkshire has stayed in Tier 1. So that's some of the conversations that are going on behind the scenes. But as I said earlier, that's not a local decision, it's a national decision, and we don't have a great deal of influence over that locally.
Thank you very much. And I'm sure I can make a more political comment to say that one of the things that has really frustrated us is that you don't get confirmation of decisions from the Department of Health apart from looking on Twitter or leaked media briefings, and how we really need to get them trusting public health teams and directors of public health and communicating decisions, because that's the best way to get confidence and to communicate to communities what these systems are, what they mean, and the impact that it has on local areas. And that's why if you've been watching sort of the news from Liverpool, Manchester and Leeds, you're getting so much noise and frustration. Is work with us, communicate with us, and let us sort of help protect our local populations. And that's part of the reason why I think you're seeing very quick announcements in very quick succession without great communication to local teams. One quick question I'm going to try and get on is one to Andrew, which was, it could be either Andrew actually. How are businesses preparing to ensure that the holiday shopping time, and that reference to Christmas, will be safe for both retailers and shoppers? So with an eye on time, I don't know if I go to both Andrews for a quick response to that one. Who'd like to go first? It's when nobody unmutes.
Right. I think there's a lot of effort has been put into getting the physical business areas ready that the masks, mask wearing, really getting that message through, because it gives confidence. We're talking about confidence and making people feel at ease. So that's a lot of effort has gone into hand sanitizers and ensuring that posters like the one here are across the city, just to reinforce and prompt people to behave in a considerate way to other people. I think retail is very conscious that Christmas is crucial to the ongoing operation of businesses, and I know Andrew has been very active in that as well.
Andrew.
Yeah, I mean, I think, we all saw the unfortunate media coverage of York a couple of weeks ago, didn't we? Where we featured on national news. I mean, just to clarify, for because I know we've got public watching, the reality of that wasn't quite what it was painted in the media. I think it lasted about 7 minutes. It wasn't organised. It was actually a busker who decided to play Mr. Brightside. Probably a good choice of song, and it whipped up a crowd, and they were there. But it was dispersed peacefully. It kind of went down. I suppose the reason I say that is that obviously painted a bad picture. It wasn't good for the city. However, if you think that was just one incident, and if you go back all the way since non-essential retail opened back in June, and I can say this for a fact because we work very closely with the police. We have our York Street Rangers, and I can tell you we've had very low instances of non-conformity from the public. People have been abiding by the rules. Our street rangers have reported very few problems. So the reason I'm saying this is York is a very safe city. It's a welcoming city, and as Andrew says, we've made a lot of efforts. The businesses have made a lot of efforts to try and make people welcome and reassured. And and I think the local population have responded to that. We're beginning to monitor more closely who uses our city, and kind of collecting data. And I've got the stats in front of me here. Last week, 70% of the people who used the city centre were from the York area. So sometimes, we've got this myth that locals don't support the city centre, but we've now got the data which shows that that's clearly not the case. So, I mean, I know that we had the question from Faye earlier on about, can she come in from Rydale? And, as a rallying call, I'd say, yes, please do, bearing in mind what Sharon said, do it in a safe way. Obviously, there's now the new guidelines we have to abide by in terms of indoor rules compared to the outdoor rules, but city businesses really need you now more than ever. And I can assure you that we're working very hard with all the businesses to make sure they stay compliant. And we will work very hard to get the messaging out there that York is open for business, and please do come in and support your local businesses.
Thank you very much for that. So with an eye on time, I'm going to go to Phil for the last comment, and it's a question really, which is primary care open?
Yeah, thank you, Keith. And yes, it absolutely is. Our GPs tell us that the demand for their advice and their care is now at pre-COVID levels and growing. However, we do in the city have good practices and a good standard of GP support. And although it's different in terms of how you get that support now, it is still absolutely available. So either face-to-face or telephone consultation or video consultations are all absolutely available. And a message that I would want to convey alongside, please get your flu jab, is through this next phase, whether York is in tier 1, 2 or 3, general practice will remain open for you. So if you have any concerns about your health or your family, please access services in the way that you would have done previously. General practice is there for you.
Thank you very much for that. I'm going to have to start drawing everything to a close now. But as we said, keep leaving your comments on the Facebook page, and our team will try and answer all of those within 24 hours. You can look at the york.gov.uk/local restrictions to get far more information about what we've talked about today as well. And there will be future Facebook Live Q&As covering a lot more topics. It's really valuable for us to hear your views and get your questions in advance. So thank you very much for that. I'd also like to repeat my thanks to all of the panelists this evening and for giving up their time and for their insight tonight. Once again, thank you for joining us tonight, and I hope you all have a good evening. Bye-bye.